Today, we're diving into the pretty high-stakes world of medical data, specifically diagnosis documentation for maternal care. Now, I know what you're probably thinking. Documentation, sounds kind of dry, right? Well, stick with me, because we're about to see how just a few simple words in a system can change literally everything for a patient and for a whole hospital.
So, let's kick things off with a little puzzle to get our brains working. When is a headache not just a headache? Or a fever not just a fever?
And there's your answer. When it's complicating a pregnancy. That single idea is really the key to everything we're about to talk about. See, pregnancy changes the entire context of medicine, and it absolutely has to change the context of how we document it too. So, here's our roadmap. We'll start by looking at this whole thing as a high-stakes puzzle. Then, we'll walk through 4 key principles for getting it right: putting pregnancy first, harnessing the power of specifics, and, of course, documenting deliveries and everything that comes after. And finally, we'll connect the dots and see how these notes lead straight to better care. This really gets to the heart of the challenge for every clinician. You've got to decide when an everyday illness, something like an infection or high blood pressure, officially becomes a pregnancy complication. It's a judgment call, but one with huge implications. Now take a look at this. On the surface, these two phrases look almost the same. But in the world of medical data, they might as well be on different planets. Anemia is just a general condition. But adding those 2 little words, complicating pregnancy, completely changes how that case is analyzed, how resources get allocated, and how the true clinical workload at Hospital Sultan Idris Shah Serdang is actually understood and measured.
So how do we nail this every single time? Well, that brings us to our very first principle, and it's all about making sure the main character of the story, the pregnancy itself, gets the starring role it deserves.
All right, principle number 1. This is the absolute foundation. If you get this right, you are already halfway there. For real.
And the rule is actually pretty simple, but it's incredibly powerful. If the pregnancy affects or complicates the other condition, it has to be documented as the main diagnosis. Just think of it this way. If the pregnancy is making you change your management plan in any way, shape, or form, then it needs to be listed first. Period. And this example just makes it crystal clear. When a condition is tougher to treat because of the pregnancy, it's not a standard diagnosis anymore. By flagging it as complicating pregnancy, you make sure the case is correctly seen for what it is: maternal care, not just general medicine.
Okay, so once you've put pregnancy front and center, the next step is all about the little things. Let's talk about the incredible power of being super specific.
Which brings us to our second key principle. This is where good documentation really becomes great documentation.
So here's the deal. You have got to make the relationship between the pregnancy and the condition obvious. It is not enough to just write hypertension. No way. You have to specify hypertension complicating pregnancy or pregnancy aggravated by pre-existing hypertension. You're basically painting a clinical picture with your words, and that picture needs to be in high def.
So why does all this detail matter so much? Well, for starters, it captures the true clinical complexity of the patient's care. It tells the story of a patient who isn't just dealing with one thing, but 2 intersecting health situations. And that's a much more complex scenario to manage.
And reason number 2, it makes sure the case shows up correctly in the hospital's data and reports. Without that specificity, the real workload and acuity of the obstetrics department can become kind of invisible in the data. And do you know what that leads to? Under-resourcing, understaffing, and a cycle of burnout.
I love this. It just flips the script and the whole task, doesn't it? A discharge summary isn't just about closing a file. It's about creating a vital piece of data that's going to inform future decisions, future research, and future improvements. The notes you write today are literally building a better hospital for tomorrow. Okay, we've covered conditions complicating a pregnancy. Now let's talk about the main event itself, the delivery, and what happens in that crucial period right after. So this brings us to principle number 3, and it's all about documenting deliveries the right way. The only thing separating a routine delivery from a complicated one is your documentation. For a simple birth, normal delivery is probably fine. But if there are any complications, we're talking tears, hemorrhage, anything, they have to be clearly documented. If it required extra work, it needs to be stated. And this rolls right into our 4th and final principle. Always, always link postpartum complications back to what caused them. If a patient comes back with an infection after a delivery, it's not enough to just write endometritis. You've got to specify endometritis following delivery.
That simple tweak is what separates an obstetric issue from a general medical one in the data.
So we've walked through the 4 big rules. Now let's just zoom out for a second and see how all these little acts of precision come together to make a massive impact across the entire hospital.
And here they are, the 4 big take-home messages all in one place. 1. If pregnancy is a factor, lead with it. 2. Be specific about how it's a factor. 3. Call out any and all delivery complications. And 4. Always connect postpartum issues back to what happened before. Seems simple, right? But it's revolutionary in its impact.
And this, right here, this is the bottom line. Every single line a clinician writes has a ripple effect. It directly determines how we analyze outcomes, how we plan for staff and resources, and ultimately how services at Hospital Sultan Idris Shah, Serdang get better for future mothers and their babies.
What a powerful way to put it. Your notes are not some passive record of the past. They are an active force. They shape how our care is seen, how it's measured, and what the future of that care is going to look like. They literally define the story of our challenges and our successes.
And that leaves us with this final thought, a kind of motto for this whole process. Document with precision, lead with clarity, and improve with purpose.
This explainer was brought to you by the Case Mix and Clinical Governance Unit at Hospital Sultan Idris Shah, Serdang. Thank you so much for your time, and remember, document with care.